Old treatment is getting a fresh look in the race to treat patients with coronavirus. The Christ Hospital is one of the hospitals researching using plasma to treat these patients. Dr. Dean Kereiakes is leading the charge on this at Christ, and he joins us live via Skype this morning to discuss this exciting development. Good morning, Dr. Kereiakes.
Good morning.
So tell us a little bit about what you're doing as the lead researcher and looking into the issue of convalescent plasma as a treatment.
Well, you know, there are very few treatments that are available for these patients at this time. And the concept of using patients that have recovered from an infection who have developed immunity and taking their antibodies that confer immunity and giving them to someone else who hasn't been able to develop immunity in a time course is not new and has been effective in the past for other severe viral infections, including H1N1 and Ebola. There have been an experience limited for coronavirus and for COVID-19 as well, which appears to be effective. The only way you can really test the efficacy and safety of such a treatment is in a larger scale clinical trial. And this trial that we've developed, I think maybe is more innovative than other trials that are out there, in that we've also using a marker to show us, lead the way, and tell us which patients are most likely to benefit by showing us which patients are greatest likelihood to die. And by defining that, we're going to focus therapy upstream at a time course when we think they'll have greater benefit to be gained by the treatment.
So Dr. Kereiakes, how many people do you have participating in this trial right now?
Well, right now the trial is gearing up. Other than one-off emergent FDA INDs for treating an individual patient, which this is not, we're linking together between 6 and 9 centers, including Case University Hospitals, OSU, Riverside Methodist, and several institutions in Cincinnati. We've already been approached by the Mercies and by St. Elizabeth.
So you are a cardiologist. So
Yeah.
How exciting is this for you as a cardiologist now? This seems like a completely new undertaking for you.
You make a great point. Number one, I've run a very successful and extensive clinical research center, so it's really a turnkey operation for addressing the needs of the community, and this is certainly a need. Second, the marker that we use to point out which patient should be treated is a troponin, which is a marker of heart cell injury or myocardial injury. And believe it or not, up to 25% or so of these patients, when they're admitted to the hospital, if they're sick enough to be admitted to the hospital, will have an elevation in their troponin. Those patients are 5 to 10 times more likely to die in the hospitalization. So that's why we're going to focus therapy on that group of patients.
It's very interesting. Well, thanks again. We'll be looking for how this develops and how it comes out. Thanks again, Dr. Kereiakes, for joining us this morning.
Thanks for your interest.